All right, good morning, everyone. Good afternoon or good evening, depending on where you are in the world. I am delighted to see you all here this morning. Many of you I saw and spent a fantastic evening with on the Lake of Lugano. I hope you got a good night's sleep. Those of you who are at home or at work or wherever you may be joining us, I'm sorry you missed the great event, but there will be many more opportunities for you in future years to join us at the lake. So we have, I think, a very important plenary discussion this morning. And that is something that you all know incredibly well. You're dealing with in your home countries, you're dealing with this in your personal life, you're dealing with this in your work. And that is the challenge we have of too much information, misinformation, disinformation, conspiracy theories, and fake news. And we talked a little bit about that yesterday. And I know many of you have mentioned that this is a real challenge for you in the work that you're doing in public health around the globe. So I'm delighted to tell you that we have two amazing experts with us here this morning from different settings and doing a little bit of different type of work, but they're both dealing with the challenges that you are dealing with. And so I'm going to turn it over very quickly to my colleagues, Tim and Chine. And Tim's going to speak first and share with you some of the work that they're doing at WHO. So those of you who don't have the good fortune yet or haven't had the good fortune of actually meeting Tim or hearing him speak, let me tell you a little bit about what he does, and then I'm going to turn the screen over to Tim. So Tim is the head of the unit for high impact events in the Epidemic and Pandemic Preparedness and Prevention Department of the WHO Emergencies Program. Joining WHO in 2006, working as a technical officer in the Yellow Fever Program, which coordinated an initiative funded by the Gavi Alliance to provide 40 million doses of vaccine to the most at-risk populations. In 2008, he joined WHO's Global Influenza Program and took part in the global response work to the first influenza pandemic in the 21st century. In 2011, he was the founding member of WHO's Global Hepatitis Program and project manager for the development of the first WHO treatment guideline for HCV. From 2014 to 2017, he was the unit leader for knowledge management, evidence, and research for policymaking at the WHO Regional Office for Europe, based in Copenhagen, Denmark. There he established the Scientific Journal of Public Health Panorama and developed the WHO Europe Resolution and Action Plan for Evidence-Informed Policymaking. So I am delighted to welcome Tim to Lugano virtually, and I'm going to stop sharing my screen, and Tim, I'm going to let you take over.
Thank you, Susan, for the kind introduction, and good morning, everybody. Just give me a sec to share my slide, and I think we can start right after that. Okay, I'll be hoping the slides are showing now on your screen. So again, welcome from wherever you're joining. I'm very delighted to give you a brief introduction about our work on infodemics and infodemic management and what we here at the WHO understand with this. So on the first slide, I just wanted to give you a first impression, about the problem. And I think we as human beings are always very inclined to rumors, to sensational stories rather than the factual news. And I think this is a cartoon depicted in 1997. So this is way before we ever talked about infodemics. And it's just, trying to send out the message, we're dealing with misinformation, disinformation, and rumors, ever since in any kind of emergency and outbreak situation, because people are very stressed and people are afraid and fearful. And I think that's the human kind of clinching we are dealing with in such a situation. So very early in February 2020, we already foresaw that, in the next months and years, while dealing with COVID-19, we also need to deal in parallel with what we call an infodemic. So it's a merger of two words, information and epidemic. And it's not even us, WHO, coming up with this. This was already coined in 2003 by a Washington Post journalist dealing with the first SARS outbreak in 2003. But what we mean by an infodemic is not just, the issue around mis and disinformation, but also issues around too much information, too much good information, where it's hard for people actually to find what's actually correct and helpful for them. If you look into the first 9 months of the pandemic, I think at that point we already had 200,000 journal publications published around the topic of the COVID-19 pandemic. So even, the scientific community was producing en masse publication, most of it not very useful, but still out there that you need to sift through and really see what is actually relevant and helpful for the response and what evidence is actually applicable for public health policy making. So I think that's, something, a phenomenon that is really coming together in this COVID-19 pandemic. And on that basis, we decided here at WHO that we also need to manage this infodemic and created a new discipline based on evidence-based intervention that we believe could be working, rather than just doing practice and thinking what could be a good approach. But how do we link this new kind of discipline in the kind of evidence that has been produced and has been shown to be impactful? Why are we doing this? Because we do see that the infodemic has different kinds of impact. First, we see direct impact on health through increased morbidity and mortality. We saw people taking certain remedies such as chloroquine because they heard on the radio that it could kill the virus. We have seen in Iran that about 700 people died and 5,000 people hospitalized because they heard on the radio that methanol was a cure against the virus. Another impact is the misunderstanding of health information and behaviors then that people adopt. We've seen that, there are certain parts of the population who are really anti-mask and don't believe that this is an intervention that works to help not transmitting the virus. But also what we see is the mistrust in societies and population towards government, towards science, towards the experts, the public health authorities in general, and as I said, in the interventions such as vaccine and therapeutics. And also the stigma that has increased. I don't know if you realize, but in the first couple of weeks in the pandemic, me as Asian descent, I had received bad looks from people on the streets because they thought China was at fault for spreading the virus. So I think this is some of the examples of the impact we see resulting from an epidemic. And what we're trying to do, of course, now is try to quantify this kind of impact through a burden assessment of what the infodemic caused in terms of mistrust and health impact. So why are we in this situation? And I depicted these two slides. I actually need to update them because this is data from 2020. But one of the drivers is, of course, that technology has changed the way we look at information, we perceive information, how we become ourselves distributors and medias of this kind of technology. So on the left side, you see, the kind of population that already have some kind of a phone. So you have 5 billion people, almost 67% of the world population have a phone. And I think if I count correctly, we have more people access to phones than to safe toilets in the world. And also the internet use. We are almost at 60% of people who have access to internet, and this is growing. And so I expect in the next pandemic, hopefully not in my lifetime, we will have every single person on the world connected to the internet. On the right side, I'm just show you the increase of social media use. So 2009 was my first pandemic I responded to, and all the kinds of Facebook, Twitter was at the start. And then compared 10 years later, we have almost 3 billion people on some form of a social media account and being able to access all kinds of information all around the world in an instant. So how do we perceive information and how it's being distributed? So this is a kind of a comic that a colleague in New Zealand, developed. And when we looked at in the beginning at this, we try to believe that information acts like a virus, and if you get a person to stop sharing, you also break the chain of information spreading. And this is how we would like to see how information spread, but that's not the reality. The reality of how information spreads on social media looks pretty much like this. So this is research conducted by Neil Johnson from the Georgetown University in the US. And he looked at 100 million Facebook users and looked at them, how they communicate or discuss vaccination issues. And what you see here basically in green are those people who are neutral towards a vaccination. The red ones are the ones that have an anti-vaccination attitude. And the blue ones are those supporting vaccination. So that's us here in this room, in this community, who are public health officials who are striving to become public health officials to support vaccination campaigns. But what this slide is showing us are several things. First, the blue ones, so us, we are talking to each other. So we are not really reaching the green ones, the undecided ones. Whereas the red dots, those are against vaccination, are very well invested into those that are undecided. So the reds, even though they are in the minority, they have better outreach to the ones that have an undecided view around vaccination. And even if you take one dot, red dot away, there's just others, that are really embedded into these online communities. And I think this is really telling how the reality looks like, how information now flows and how people are connected to each other, and understanding, how we better reach, or who do we need to communicate to on social media to have a better outreach to those ones that haven't taken a decision yet towards vaccination. And so this is more data from Neil Johnson that he shared with us, and it's really interesting how the information highway, how the information ecosystem works nowadays, and how we need to understand who are actually so-called influencers. And this is actually, and if you go in more detail into his literature, influencers are not necessarily the actors, the sports people alike, but it's often people we actually don't know, but who are very embedded into different communities and have outreach and have moderation skills on these platforms. I think this is a whole new type of research that is coming up in this area, where I encourage, also you in the research community to really invest into this kind of research analysis to really understand how this information ecosystem works nowadays, and how you can help us in public health to understand this and translate this into policies that have more and impactful action. So what can we do about this? So, we started to develop a framework based on how can we use science, and we build here on the science of infodemiology to develop those interventions that have better impact on behavior change and epidemic risk mitigation. And the key interventions we are looking at is, first, listen to the concerns of these communities and understanding what are the information voids, what are the information gaps we are not filling to answer the questions they have. Second pillar is really how to communicate risk and distill the science, because with the ever-changing science over time, people are getting confused when 1 week we say this and the next week we say that. And this is really understanding, helping them understand that science is a process of finding and new evidence and interpreting the situation. The third element we're trying to do is promote resilience to misinformation. And this is really important to me is there's just too much misinformation out there, and we cannot debunk, pre-bunk all of this. And we need to have a system to build resilience in population that they themselves can better detect when they being misled, and can self-act on this skill that they acquire. And the fourth element for us is really engage and empower communities to take actions in their own hand, rather than rely on public health institution and government alone. So what I did in the beginning of this pandemic was really to build a public health program around this. And this has four major strategic axes. And whenever you come to WHO and want to create a public health program, this is basically the four-step recipe to build any kind of public health program if you want. The first one is really define the framework, the strategy, and an action plan. So what we did is really we created an online consultation, invited 1,000 people, and they helped us to form the kind of actions that is needed at the global level, where everybody in our society can take part. So it's not for you to do all the 50 actions, but you can take 1-2 actions here and see how you can contribute to the global strategy towards mitigating the infodemic. So there are actions here for journalists, action here for academic institution, action for public health professional, for physicians, for nurses, and for social media companies. And if we all contribute to one of these actions, we can help towards really mitigating that impact. The second thing we did was really building the science around infodemic management. I mentioned before infodemiology. And what we try to do is to build an interdisciplinary approach. So this included not only communication specialists, journalists, but also inviting physicists, mathematicians, epidemiologists, medical doctors into a conference to define what are the key research questions we need to answer in the following years to better understand the impact of misinformation on people's behavior. We like to believe that seeing a Twitter post with a misinformation leads to a certain action. And that is not actually the reality, how people actually adopt and change behavior based on one misinformation, but it's a process that is being happening here. And I think understanding this process is really important in order to build the right interventions that have a more and bigger impact. The third area we've tried to build is really support the countries. As you know, WHO is a member state organization. We have 194 countries, and it's really important we build those capacities in countries that they can respond to this. And we developed a couple of toolkits for them, and one of them is so-called EARS, the Early AI-Supported Response to Social Listening. And what's happening here is this is a AI-driven tool that sifts through 10 million posts a month to really analyze what are people talking about and putting it into categories. And I will show you a bit more of this tool later. And the fourth category strategy we developed was really develop the profession around infodemic management, really putting out a new curriculum about the skill set that individuals can put on their CV in terms of becoming an infodemic manager. And we trained about 1,000 individuals from 130 countries to become infodemic managers and help with the COVID-19 response in their countries. So this is the example of the social listening tool, what we did. And what this does is on a daily basis, really scrap social media postings, and the AI tries to categorize this in 39 narratives categories. And what it helps us then to see is what is the talk of town. what are the key areas people are discussing. Are they discussing it in a positive or negative sense? And then helping to take action in terms of this week, we need to talk more about a vaccine. This week, we need to talk more about mask wearing, and trying to understand what are the information voids or gaps that people are experiencing. And we started to do this now for 30 countries, so we can break it down. What is the talk of town in 30 countries? And this is basically a pilot tool, and we see a lot of potential in further developing such tools in the future to better understand and then help to tailor messaging, to tailor guidance to countries, and also to double check if people understand our guidance and our recommendations. So what are my key takeaway messages for you this morning? First, now we often like to see, okay, who is spreading misinformation and what can we do against these actors? That's one strategy. But what then we often forget is the majority of people are neutral. They are still undecided. And we also equally need to see, how do we win this group over? What can we do for these majority to help them drive through this kind of crisis? Second is we need to be where the conversation is. Many public health organizations do not have a good online presence. They're really not using the opportunity indirectly to better understand what communities are discussing. So here is an area where we can help to fill those information voids. Third is listen and understand the concerns. Often we're just telling people what they need to do, but they have complex reasons. Why are they not acting or not accepting a vaccine? And I think this effort in better listening and understanding the concerns, then rather being too proactive of doing something that we believe is correct, is a paradigm change often in risk communication. The fourth thing is really the way we distill science and break it down to people that they understand it. Maybe you remember very early in the pandemic, somebody created a GIF of understanding how to curb the pandemic, the epidemic curve, by showing, if you do these public health measures, you can lower the curve and win time, so we can get up that prepared. And this was a GIF that was really highly shared among social media accounts, and was really helping to explain to general population why it's important to wear a mask, wash your hand, and keep a distance. The fifth thing is really work with trusted amplifiers in communities. Often governments are not the most trusted source in a country. If you recognize, one major big country in this world, only 50% of people are going to vote, and then only 50% of the 50% actually vote for the president. So in total, I think not even the majority is standing behind a government in some of the countries. I think it's important that we need to identify those trusted voices in communities that can also amplify key recommendations. And lastly, really, let's focus on building resilience to health misinformation, and rather, trying to pre-bunk or debunk every piece of misinformation, and build that trust and health and digital literacy in populations, so they can take self-action towards the infodemic. I stop here, Susan. Thank you very much.
Thank you very much, Tim. We're going to now move on to a presentation from Chine, who's going to talk to you about some of the work that her company that she works for, NewsGuard, is doing, and some of her other expertise in the area. So I'd like to introduce to you Chine Labbe, who is the managing editor and the vice president of partnerships for Europe and Canada at NewsGuard, which is a US company that provides credibility ratings and detailed nutrition labels for thousands of news and information websites, and alerts internet users on sources of misinformation. She's based in Geneva. Before joining NewsGuard, she was the host and producer of Good Code, a podcast on ethics in digital technologies that she created in 2018. She did that with work with the Cornell Tech's Digital Life Initiative, in New York. She previously worked for 6 years as a print reporter for Reuters in Paris, where she covered politics, courts, security and terrorism, and as a multimedia producer for The Economist in New York. She's a former Fulbright scholar and graduated from a dual degree program between Columbia University Graduate School of Journalism and the Sciences Po Journalism School in Paris in 2010. Chine, I'm very delighted you're with us. Thank you so much for joining us online. And I'm going to make sure you have the ability to share the screen. If you could try that.
I do. I can already see it. Thank you so much for having me. And let me just share my screen. Can you all see my screen now?
Yes, we see it.
Great. So thank you so much for having me. It's a pleasure to be here today. I regret not being by the Lake of Lugano. You're lucky to be there. It's beautiful. So as Suzanne just kindly introduced me, I work for NewsGuard, and I'm just going to tell you a few words about NewsGuard before explaining to you really what we did about the infodemic that we're just we've known since 2020, and we're still living through today. What are our successes, also our challenges, and what are some solutions that we're seeing to face such an infodemic. So just a few words about NewsGuard first. NewsGuard is a company that is US-based, was created in March 2018 by journalists. With journalists. So it's really a journalism endeavor. And the reason for it being created was really to fight online misinformation, including health misinformation. And the idea was that after what we saw in 2016 with the US presidential election and the disinformation campaigns that we saw at the time, what solution can we bring that's an alternative to fact-checking that can really be a solution to misinformation? So our idea was to not rate news rate individual pieces of news like fact-checkers do, but to rate news at the source level. So rate news sites in general, blogs in their entirety. And so at first we created a browser extension with the idea to help users navigate online, giving them some ideas on the credibility of the sources that were feeding them the news online that they were encountering on the news feed, on Facebook, on Twitter, etc. But now we really have two distinct databases, and we work with many different actors. So one is a database on the reliability of news sources, and one is a database on the most important, most popular myths that are circulating online on many different topics, on COVID-19, on monkeypox, on the war in Syria, on Ukraine, Russia, etc. And so we work, as I was saying, with many different actors. We work with researchers, with social media platforms, with brands, ad agencies, teachers, governments, etc., that use our databases to help them in their fight against misinformation. So just to explain again quickly, why did we think we needed to rate sources of news instead of individual claims? The idea, the vision really behind our company was that if you walk into a library, you see neatly arranged books, on their shelves. There are covers that tell you the title. You usually have a bio for the author. They are neatly arranged by subjects. You have a librarian that's here to help you, telling you which book you might want to add to your selection if you're selecting this author that might have that bias, etc. When you're online, especially when you're on social media, and a lot of people we know that are getting their news on social media today, you don't have any of that. And it's sort of as if you were walking into a library with lots of sheets of papers floating around you with no information whatsoever on where the news is coming from, who's the author behind it, who's sponsored that content, etc. So that's what you have online when you have your grandmother or your cousin or your uncle sharing some pieces of news via WhatsApp, on your Facebook feed, etc. And sometimes with people just reading the headline and sharing quickly the headline without having any idea what the sources of that information are. So that's the vision and the idea that propelled us to creating NewsGuard. And so here you see what it sort of looks like. If you navigate online, you have a little icon of color that tells you quickly if it's generally reliable, generally unreliable, and then you can see our ratings, which really inform you based on credibility criteria. on what that piece of news is. And so today we've rated over 7,900 news sites. We're in 6 countries. So I've put that quickly here. We're in several European countries, Canada and the US. And as I was saying, we've also cataloged a lot of the most popular myths that are being shared online, which is about 350 today, not including the variations of every myth. So just to finish on NewsGuard, what we really do is not telling you, okay, this source does great journalism, this source has amazing writer. It's really not the goal. The goal is really to separate between responsible outlets and blogs, alternative news sites, etc., that really don't intend to do any responsible journalism, and don't have any standard by which they adhere. So our standards, as you see here, of credibility and transparency are really basic. We really haven't invented hot water at all. It's really, does the site publish repeatedly false news? Does it gather responsibly? Does it cite its sources? Does it correct its errors, etc.? Does it tell you who owns it and if there is a conflict of interest? Very basic things. And here you see what it looks like. Little icon, you click, you see the short summary, and then here you have the full nutrition label. We call it nutrition label. It's a bit barbaric. The idea is to compare it. It's voluntary to compare it to what you have on a pot of yogurt or a pot of whatever junk food you might love to buy in a supermarket. We're not going to tell you don't buy it, just like in a supermarket, you're not going to be prevented from buying that junk food that you love, but at least you'll know what you're about to eat. You'll know what your nutrition diet is. And here it's the same idea with information diet. So our objective really was twofold: both alert users on misinformation sources, but also contribute to a healthier information environment. So helping news sources, when they fail some criteria, getting better. And so we work closely with news sources now, even the very credible ones that you know, and we help them just getting even more transparent, even more credible, because as Tim also quickly mentioned, the loss of confidence in authorities includes loss of confidence in media as well. So working on fighting misinformation also requires us to help people trust more trusted sources, and that requires them to be more transparent, more credible, etc. So why am I here today to speak with you, and why was I kindly invited to share a little bit of our experience to talk about the infodemic? And that's the great image that I took from your website for today. Our efforts, our successes, our challenges. So when the pandemic started in early 2020, what did we do? We started right away by, that's what we do whenever a crisis occurs or whenever there's a big news event, we create a misinformation tracking center on that topic. We did that for the US presidential election. We did that for the French presidential election earlier this year. And we did that for coronavirus as soon as it emerged. So we tracked on a site, on a page on our website, all the websites that were spreading misinformation and the principal myth that they were sharing. Today, we're still updating that center, and it now includes more than 606 sites spreading misinformation. That's, of course, the bulk is in the US with 386 websites, but you can see here on the right, we have lots of French language website. I put France here, but really it's French language. So it includes some African based websites, some Swiss, Belgian websites, etc. Same for Germany. It's actually German language, so some websites from Austria, etc. Italy, Italian language websites. And those are, just to give you a sense, those are really anything and everything. Those includes websites that are notorious health misinformation spreaders. Earlier in one of my slides, you had the Natural News Network label that was featured. That's a very well-known network of sites that has spread a lot of misinformation on a lot of different health topics. But you also have political websites that have nothing to do with health, but during COVID started sharing a lot of false news on health. You have conspiracy theory websites that write on anything and everything every basically news outbreak that can be interesting for misinformation, and some websites that were created specifically to spread misinformation. And those are sites that pretend to be legitimate news outlets, blogs, sites that say they are connected to think tanks, etc. Really, it's very varied, very diverse. And the myth, I'm not going to teach you anything. You've all seen all these myths. They went from the COVID-19 virus was stolen out of a Canadian lab by Chinese spies to it's actually a group that was funded by Bill Gates that patented the COVID-19 virus, to Bill Gates again plans to use the pandemic to implement chips through mandatory vaccines into every single human on the planet. Bill Gates having been a very central character in a lot of myths that were circulated on the pandemic. So we still continue to this day cataloging this myth. And for every single myth, there are variations to that myth. So the Bill Gates myth, there is the idea that he patented the virus, the idea that he orchestrated the pandemic, the idea that he planned the pandemic. There are so many variations to a single myth that, as you know, it's very hard to track them, and they evolve very quickly. And why should we care? Tim has given you already a good idea of that, but it's important to note that we care because, as for you, public health specialists, when we talk about misinformation, I gave you some that were more in examples that were more conspiracy theory types, but you also had a lot of false cures, the idea that hot water and lemon can cure COVID, false news on government measures, masks are actually worse and they're going to make you more sick. All claims that can bring people to stop taking the necessary measures against the pandemic and take very concrete public health risks. Also, as Tim has noted, misinformation can contribute to vaccine hesitancy. And just to give you two pieces of data on that that are not from us, but from very interesting research that was done on the topic. On the left side of the screen, you see that was a very interesting COVID states project, a 50-state US polling project that was launched in March 2020 by several researchers at several universities in the US. The idea was to measure opinions on the pandemic. And what they showed is that they did 19 surveys from April 2020 to July 2021 that indicated that not only people believed false claims about COVID-19 vaccinations, but they were more likely to jeopardize their health because of that. And actually, one of the professors who participated in the study even showed that most deaths occurred in regions where misinformation was more prominent over a series of months in late 2020 and early 2021. And as to COVID vaccine hesitancy, there was a study done at the Imperial College London in February 2021, and it found that exposing people who stated that they would definitely accept a vaccine to recent misinformation induced a decline in their intent by 6.2 points in the UK and 6.4 percentage points in the US. That's huge. And here we're talking about people who are surely getting the vaccine, not the people that don't know, that are the majority, as Tim mentioned earlier. So a few teachings to what we saw during the monitoring the COVID-19 pandemic and doing this work of both looking at the sites, spreading the myth, and the main myth that we were seeing. The first interesting learning is one thing to look out for is the data misuse and misinterpretation. And one big, very famous example of that is how VERS data and data from the equivalent, the European equivalent of VERS, was misused and used to propel false claims about the vaccines. So for those that don't know VERS, VERS is the Vaccine Adverse Event Reporting System in the US. So it's a database where that really is supposed to work as an early warning system. So anyone and everyone can submit reports to VERS of events that happened after getting the vaccine. And of course, these reports are anyone can submit them. They're not verified, and the goal of that is really for the U.S. government, the CDC, the FDA to work as an early warning, and then for them to check, is there a risk with that and that adverse risk. The problem is that you have all these reports of events that perhaps is just someone died in a car accident after getting the vaccine. You know, there's no relationship whatsoever with the vaccine, but it's still listed there. On the way back home, driving their car, so-and-so died, and he had just getting the vaccine. And that has been used a lot on misinformation websites to spread false claims about risks, alleged risks about the vaccine. So that's one thing where there is a lot of education to be done on the use of the data. And what's important to note is that those websites, the websites of VARST and the European equivalent, are very good at telling users that, you know, the data has not been vetted, and yet it's not enough because it's shared on other platforms where the warning, the caveats are not there. A second learning is that a lot of problematic reporting was done on studies that were really lacking rigor or that turned out to be false later. So one famous example of that is a study that was published on biorix.org. That's a website where people can submit studies that have not been peer reviewed. And it said that basically COVID-19 virus contained HIV-like insertions. And that was used to claim that the virus had been manipulated, had been modified by humans. Of course, that study lacked rigor and had been, actually it was taken out of that website 2 days only after being published, but that was too late. It had already made the rounds. And we know that a false study, a study that's problematic, can still make a lot of damage years later. A very famous example of that is the Andrew Wakefield's 1998 study that suggested a possible link between autism and the MMR vaccine. To this day, even though that study was withdrawn, it's still making a lot of damage. One other important learning is that many misinformation providers are repeat offenders. We've seen a lot of the sites that we catalog on our COVID-19 misinformation tracker websites that we had already tagged as misinformation providers, but before they were publishing news on other topics. And one thing that we're just noted now with following what's happening in terms of misinformation in Ukraine is that almost 100 websites that we had identified in our COVID-19 misinformation tracker are now disseminating false news about Ukraine and the war. So that's something that's important to note, because that means that we need to do something about these repeat offenders. Very quickly, I wanted to talk about a case study, TikTok. It's an important platform, and I wanted to say a word about it because, of course, it's huge. It has more than 1 billion monthly active users now. It has a very young user base. A quarter of the app's users in the US in 2021 were between the ages of 10 and 19. And the app's design, I don't know if you've used the app yourself, it's really favoring endless scrolls of short videos. There's no context whatsoever. So it's an important app to watch. And we were really worried to notice in an experiment we did in September 2021 to see that without any prior engagement, without following any specific topic, any specific account, TikTok was feeding false news about COVID-19 to children as young as 9 years old within 40 minutes of connecting to the app. How was it possible to feed it to children as young as 9 years old when the app is actually forbidden to children below 13? Well, because there's no verification, real verification of the age. So we had young users with their parental supervision do it to show that actually very young users could use it if they wanted to, and they were fed dangerous misinformation. Now, just very quickly, what kind of misinformation are we seeing at the moment? We're seeing more COVID-19 myth. It's not gone dormant at all. We're seeing misinformation on monkeypox a lot lately, on abortion following the Roe versus Wade reversal in the US. And we're seeing more widely anti-vax narratives. So of course, anti-vax narratives around the COVID-19 vaccines, but also more generally. And that's a very worrying phenomena if you think about how it can contribute to vaccine hesitancy, as I was saying earlier. So monkeypox, I'm not going to spend too much time on it, but just in June, we did a report to the WHO actually, where we featured monkeypox false claims in English, French, Italian, and German. And these were shown to 3.8 million people on Facebook and Twitter between May 21st and June 13. So you can imagine that's only one small sample. It's not exhaustive by any means. So you can imagine how much misinformation is being spread. And just one thing that's very interesting is that we found that a lot of the false claims circulating now on monkeypox closely mirror others that were spread on COVID-19 throughout the pandemic, which is very interesting, with Bill Gates being at the center of a lot of these claims as well. Abortion, following Roe versus Wade, I just said something about it. Just to finish on challenges, so that I don't take too long. What are the main challenges that we're seeing? The first challenge, I think, is you need to remember that misinformation is a thriving business. If it wasn't, there wouldn't be so much misinformation online. Of course, there are providers of misinformation that are ideologues. They will always do it, have always been doing it. But a lot of people, a lot of misinformation providers are in it for the money, because hoaxes generate eyeballs and eyeballs generate money online, advertising money. And also one thing that's actually especially relevant to health misinformation is that a lot of health misinformation websites also sell products. So they make money selling bogus cures. So that's one of the challenge, and it's a real big one. We've estimated that approximately $2.6 billion each year fund misinformation providers through programmatic advertising. That's huge. We estimate that it's only 1.68% of display ad spending that goes to misinformation providers, but that means a lot of money because programmatic advertising is a huge business, and it's only an estimate, so it could be more. So that's one of the big challenge, and something needs to be done about that. The second big challenge, I think, is the limits of the action taken by the platform. So first problem is that misinformation providers are very good at finding ways to bypass the platform's measures. We've seen that with one report that we did recently about TikTok and misinformation on natural abortions on TikTok. Actually, misinformation providers, to bypass the moderation, were changing the spelling of abortion or saying natural abortion. So they're using a lot of tactics like that and are able to bypass the measures taken by the platform. The second challenge is that lots of platforms rely on third-party fact checkers to fight misinformation. And while that's necessary, the problem is that fact checking can't be our only response to misinformation, because first, you can't fact check everything. And as I was saying, for every myth, there are maybe 10, 15 variations. So you can't fact check all of these. Second, we see very odd situations on platforms where sometimes you have one myth that's fact checked on one Facebook account, and on another account, the exact same myth, but by a different website using perhaps different words, has not been fact checked. So of course, fact checking is great, but it's limited in the sense that we can't fact check everything. And also fact checking takes more time. And by the time you have fact checked a false claim, it has been replaced by others. So we need other measures. And of course, when it comes to the limits of platforms as well, it's important to note that misinformation providers continue to thrive on platforms despite the misinformation providers being repeat offenders. So we've done two reports, one in October 2021 and one in November 2021, that were looking at all the accounts, the well-known misinformation health providers that we had flagged to the WHO in reports. We do regular reports to the WHO, and we showed that many of the accounts that we had flagged were still live, were still ongoing, were still spreading false claims, and had actually gained more followers. So just to give you the example, for example, of the November 2021 report, of the 85 accounts that we flagged for spreading misinformation about the virus a year earlier, a quarter of them had grown and gaining over 1 million new followers over 1 year. So what are the solutions? I think Tim has talked about some of them very efficiently. I would say that, to me, one of the requirements is making misinformation less lucrative. So working on ways to make it less interesting for misinformation providers. news. One thing that we work on at NewsGuard, we work with brands and ad agencies to help them make sure they don't spend ad money on misinformation sites. And at the same time, they send their ad money to reliable websites, because of course, good journalism is the best antidote to misinformation. And that's my second point, supporting responsible media outlets who are, as you know, struggling. It's hard and it's hard. We haven't found the best business model yet in journalism. Then I think building interventions is important. So ours is one. Team has talked about a very interesting one, the early AI supported response with social listening, building interventions to help people know what people are talking about online, help them pause when looking at misinformation online, and help them also be wary of misinformation. And that brings to my fourth point, which is media literacy, providing tools to libraries, educators, help citizens build skills and immunity against misinformation. That's something that we do. But another thing that's very interesting, for example, is the use of video games to help people build their media literacy skills. And of course, and I'll end by that, I think platforms need to do more. I've shown the limits of the actions taken by platforms. They do a lot, but they need to do more. They need to be more transparent about the algorithms, the reach of misinformation. We still don't have any clue what is the exact reach of misinformation online, which is a huge problem. You can't combat an enemy that you don't know the size of. And that's why we are prospective signatories of them. We are signatories actually of the European Union's Code of Practice on Misinformation, to work closely with platforms and other actors to help them be more transparent and develop more tools to fight misinformation. And I'll end there. Thank you so much.